Today, we are diving into something truly radical in the war on cancer. I want you to forget everything you know about single drugs or hunting for that one silver bullet. We're talking about building an entirely new infrastructure for curing disease. Yeah, you heard that right. Let's get into it. For decades, the playbook has been pretty much this. Find a drug, test it on one type of cancer, and then start all over again. It's slow, it's incredibly expensive, and honestly, it's a huge bottleneck. But this new paradigm, it just completely flips the script. Instead of forging one-off weapons for one-off fights, the idea is to build a universal weapons platform that can be adapted to fight any cancer, treating each one like its own unique fortress.
And this platform, it has a name, the Phantom Swarm. Now, the most important thing to get your head around is this. It's not just another new therapy. Not at all. It's an entire integrated system for creating and deploying therapies, built from the ground up to be completely adaptable. So what do we even mean by a treatment platform? Okay, think of it like the operating system on your phone or your computer. The OS itself, that's the core infrastructure, right? But on top of it, you can run thousands of different apps, a game, a photo editor, a web browser. The Phantom Swarm is designed to be the OS for oncology, capable of running different therapeutic apps that are custom-built for specific cancers. And this right here is the absolute key to the whole thing. The real breakthrough isn't any one single component of the attack. It's the modularity. It's the ability to swap parts in and out to change the ammunition while keeping the siege engines the same. That's its superpower. That's what could make it a total game changer. All right, so if cancer is a fortress, how exactly does the Phantom Swarm plan to lay siege to it? Well, the platform depends on 4 universal siege engines, 4 totally different kinds of therapies that all work together in a coordinated attack. It's actually a pretty elegant 4-step assault. First, you have these low-intensity electric fields called tumor treating fields, or TT fields, that basically soften up the tumor's defenses. Second, an oncolytic virus is sent in to breach the fortress walls, which gets the immune system's attention. Third, engineered immune cells called CAR-NKT cells come in to amplify the attack, causing just massive targeted cell killing. And finally, a personalized vaccine is used to sustain the fight and create long-term immune memory, so the cancer can't come back. So if you look at the core architecture, you can see those 4 attack layers we just talked about. But look at that 5th layer. That one is absolutely critical. Safety governance. This is a huge deal. The whole platform has built-in kill switches and real-time monitoring, making sure that this incredibly powerful system can be precisely controlled at all times. So you've got these incredible universal tools, but how do you use them to fight the dozens, even hundreds of different types of cancer out there? Well, this is where that beautiful concept of modularity comes right back into play. The engines of war don't change, you just switch out the ammunition. And this chart shows you exactly how it works. On the left, you see the 4 siege engines that always stay the same. But on the right, you see the ammunition that gets customized for every single fight. You can tune the frequency of the TT fields, you can change the payload inside the virus, you can switch the targets for the CAR-NKT cells, and you can update the antigens in the vaccine. It's the same system, but it's tailored with incredible precision for each specific fortress. Now think about the strategic advantage here. It's just immense. Instead of fighting cancers one by one, a slow, grueling process, this platform strategy lets you attack entire classes of cancer that share similar defenses. That is a massive leap in efficiency. You could launch one campaign against all cold tumors, another against tumors that are stroma-rich, and a third against cancers hiding out in sanctuary sites like the brain. So let's take this out of the abstract and look at a powerful, real-world example. We're going to look at one of the toughest challenges in all of oncology, cancer that is spread to the brain. This is what's known as a sanctuary site because the immune system has a really hard time reaching it. And let's be clear, this is not some rare problem. In the US alone, 200,000 people are diagnosed with brain metastases every single year. For a lot of them, the cancer in the rest of their body might be under control, but it's the disease in the brain that becomes the fatal issue. So, a clinical trial was designed with these specific goals in mind. And I want you to notice something really important here. It's not just about shrinking tumors or even improving survival rates. A primary goal is to preserve neurocognitive function. The whole point isn't just to help patients live longer, but to help them live better, to protect their minds from both the cancer and the really harsh side effects of traditional treatments. And when you look at the treatment schedule, you can see how it plays out just like that deliberate, orchestrated military campaign we were talking about. It kicks off with the TT fields, followed by the virus injection, then the infusion of immune cells, and finally the vaccine prime with later boosts. Every single step is carefully timed to get the most powerful synergistic effect from all the different components working together. Okay, so let's zoom back out and look at the big picture again. What we're potentially witnessing here is something more than just a really clever combination of therapies. It might just be the dawn of a completely new kind of curative infrastructure, a true operating system for oncology. And there is a clear and incredibly ambitious roadmap for this phased conquest. The plan is to start by expanding the proof of concept, then move to a full-on offensive against sanctuary sites like the brain, and finally aim for complete coverage by adapting the platform for all the remaining tumor types. It's a systematic plan to try and make cancer obsolescence a reality. You know, this quote from the source material really just says it all, doesn't it? The entire goal has shifted. It's no longer about creating individual products to sell. It's about creating a single, powerful, adaptable system. That is a fundamental change in how we even approach fighting this disease. Which really just leaves us with one final, pretty profound thought. For centuries, we've been fighting cancer fortress by fortress, trying to find a unique key for every single lock. If this platform really works the way it's designed to, well, the question is, have we finally stopped looking for individual keys and instead just built the master key?